We are live in 3, 2, 1. Please start, sir. We are live.
Very good evening, everyone. On behalf of NASH 24/7, I welcome you to our public awareness program on unlocking the secrets of NASH. NASH 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. To unlock the secrets of NASH, today we have a renowned gastroenterologist from Kolkata, Dr. Kaushik Chatterjee. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Kaushik Chatterjee is a leading gastro in Kolkata, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with PLS Hospital, Kolkata as a consultant gastroenterologist. So, sir, on this International NASH Day, we salute your dedication towards spreading awareness related to the liver health. So now I would like to invite Dr. Chatterjee to enlighten us on the topic. Over to you, sir.
Very good evening, everyone, and thanks for the very kind introduction. I am Dr. Kaushik. I am at present practicing PLS Hospital, Kolkata, and I take this opportunity to share my experience related to fatty liver disease, one of the very prevalent diseases, as you will see during my presentation, and the basic ways how to approach it, how to diagnose it, and how to manage it as a non-clinical person. Then we can have live discussions. I'll be happy to take your questions and answer all your queries. So this is a brief presentation and a very basic presentation dedicated to people who are trying to understand fatty liver disease. So I'll start with my presentation. Yeah, I think probably you have seen this slide in the past presentations as well. This is a Global Liver Institute, which was launched in 2018. I'll skip this slide and directly jump to non-alcoholic fatty liver disease. So what is liver? Liver is the second or maybe third largest organ if you put it after endothelium and skin. Average weight is about, for human, it will be about 1.5 kilos and approximately has 5% of fat within itself, usually less than fat. Liver is located to the right upper hand position of the abdominal cavity. Very simple information, which is probably known to everyone, but many of my patients will come and say that they are towards the left of the abdomen, and they think that is related to fatty liver. It's actually not the location of liver, and you are not having pain because of fatty liver. So it's to the right upper part of the abdomen, unless something called it's on top of the stomach, soft in consistence, it's very vascular organ. Major work, it's the powerhouse in the body, serves a lot of metabolic function, it processes nutrients, it regulates blood composition, produces bile, which helps in digestion. It produces proteins, especially lipoproteins and cholesterols. Am I visible to everyone?
Yes, sir.
Yes, sir.
Yeah, are the slides also visible?
Yes, sir. Yes, sir. We can continue.
Sure, there was some network connectivity issue. Blood cells when their lifespan is over, and it breaks down alcohol and multiple other medications and toxins, which is one of the very vital of its function. We call it non-alcoholic fatty liver disease when fat makes up more than 5% of the weight of liver. And the reason for fat accumulation is not alcohol. So it has to be predominantly alcohol non-related cause where there is excess amount of fat accumulation within the liver. If it is left untreated, then a certain percentage of these patients will go on to develop progressive disease, which is called non-alcoholic steatohepatitis, which can subsequently progress to cirrhosis of liver, which is kind of a permanent liver injury. Now, if you are obese, if you have type 2 diabetes mellitus, if you have a high cholesterol related problem, then you are definitely at a higher risk to develop this non-alcoholic fatty liver disease. You will be surprised to know that the prevalence of this disease is about 25 to 30%. What does it mean? It means that if you pick 1 out of 4% randomly, that person can be harboring this non-alcoholic fatty liver disease. The number increases to more than 6 diabetics and 9 or more obese people out of 10. So you see, in this entire population of maybe 150 crores of people who are living in India, a huge number of people are already having non-alcoholic fatty liver disease, about which probably they were still unaware of. Male people, they generally have a tendency to progress further into non-alcoholic steatohepatitis. Now, I would like to draw your attention to this slide. This is one of the very relevant slides. This is our healthy liver. If you accumulate fat, it looks relatively more yellowish. Once there is accumulation of fat, not everyone, but a certain percentage of patients will also have inflammation within the liver because of fat. For a common person, it is difficult to understand what is inflammation. You might compare it with something like if you get a cut on your hand and if you get redness and pain sensation, kind of similar thing that is happening within the liver. There is no cut within the liver. It's the fat which is causing these liver damage. That is called inflammation within the liver, or the medical term will be non-alcoholic steatohepatitis. If you have this condition for a sufficient length of time, maybe 15 years or 20 years, there may be development of fibrosis or scarring, to put it in a simple language, within the liver. Once there is scarring, the scarring can gradually progress to something called cirrhosis of liver. Your liver from here to here might look very sick if you are not careful about your fatty liver disease. So how do you differentiate between what is non-alcoholic fatty liver and non-alcoholic steatohepatitis? It's not possible for you to feel whether you have a non-alcoholic fatty liver or non-alcoholic steatohepatitis or fibrosis. These are purely laboratory-based diagnosis. So you will not be able to feel any particular symptom by which you can make out what stage you are in or whether you at all have a fatty liver disease or not. But if you have fatty liver, there is a chance that the fat may invite inflammation within the liver, when we call it non-alcoholic steatohepatitis. If you have a steatohepatitis, the steatohepatitis over time progress to a scar tissue developing within the liver, which we call fibrosis of the liver. And if the fibrosis progresses further, there can be cirrhosis. Causes are very much related to our lifestyle. So basically, if you look at this small cartoon, if you have obesity, if you have metabolic syndrome, meaning you have diabetes, hypertension, cholesterol related problem, which is quite prevalent these days, even among younger people, if you are exposed to certain medications, if you are physically inactive, which is practically true for the vast majority of the people who are working in IT company or equivalent kind of companies. If you are more inclined towards today's fast food intake, which are rich in simple sugar and unsaturated fatty acids, and if you have some genetic background, these are the conditions which predisposes you to develop non-alcoholic fatty liver disease. So, to put it very simply, if you are overweight, it predisposes the liver to accumulate fat. If your fat accumulation increases, then you can have something called inflammation within the liver. You can have non-alcoholic steatohepatitis, and your happy liver might look very unhappy and sad with time when you will have symptoms. There is definitely increased risk of death due to cirrhosis. If you have diabetes, then there is more chance you will have non-alcoholic fatty liver disease. If you are already having non-alcoholic fatty liver disease, there is a higher chance that with time you can develop diabetes. Symptoms are fairly non-specific. Many people with NAFLD do not have symptoms. Those who have it, these are very non-specific, maybe mild fatigue, some discomfort in the right upper part of the abdomen. Non-alcoholic steatohepatitis, kind of barely asymptomatic. They can be increased fatigue, there can be buildup of fluid within the abdomen, there can be confusion in the form of encephalopathy, there can be appetite loss, there can be easy bruisability, there can be swelling of your leg, there can be unexplained weight loss, there can be jaundice, there can be varices which can bleed and you can have a blood vomiting or black stool only when you are symptomatic. Before that, you are not likely to face a major symptom and you are likely to ignore your condition. Fatty liver is a silent killer. The reason being, people are not aware that there is something called fatty liver disease. People are not aware that despite this being not producing a lot of symptom, can actually cause a serious damage to your liver with time. And not knowing that the solution to fatty liver is basically changing your lifestyle. The solution is quite simple. And the progression of the disease is also very slow. The diagnosis of fatty liver disease basically depends on blood test, especially at least a liver function test, at least an ultrasound of abdomen to look into your liver, if possible a fibroscan to assess the amount of fat that has accumulated and the degree of liver damage that has already happened. If it is indicated, then tests as complicated as a liver biopsy or more complicated imaging like a CT scan or MRI scan might be necessary. Most common blood test abnormality that we will see, I think a good percentage of patients are probably aware of it. The reason being, there are annual health checkups being held by many of the corporate companies. So if you see your SGPT, SGOT elevated, then there may be a chance you are already having a non-alcoholic steatohepatitis. Up to 80% of pure fatty liver disease can have normal ALT. There is no definite ALT cutoff, that is SGPT cutoff, which to put in simple words will be a blood test cutoff, beyond which we can surely predict that you have a non-alcoholic steatohepatitis, which will definitely progress to fibrosis or cirrhosis of liver. There are even more complicated tests which your doctor will order if non-alcoholic fatty liver disease is suspected or established to find out the degree of your liver damage. This is how the ultrasound image photos will look like. The advantage is it is available almost everywhere. Very easily done. It's economic and there is practically no risk to doing an ultrasound abdomen. It can easily pick up fatty liver. It can definitely pick up advanced stages of liver disease and its complication. But the problem is very early stages of fatty liver will not be picked up because a certain amount of fat has to accumulate within the liver before ultrasound can pick it up. You can do further complicated investigations like a fibroscan. It's complicated in a way that it's slightly more expensive. Otherwise, it's a very simple test. It's again another ultrasound guided modality, but may not be available in every possible laboratory. It gives relatively fair amount of estimation as to what is the amount of fat that is stored within your liver and what is the degree of liver damage that has already happened. Still, this cannot pick up very low or very minute amount of fat. Your fibroscan report, if anyone already has it, they will know that there are two basic parameters which are given in their report. One is a controlled attenuation parameter, which basically denotes the degree of fat that has accumulated within your liver. The other one is liver stiffness measure, which gives an indirect estimate as to how much the liver has already been damaged because of fat accumulation. In case of confusion, your doctor might order more complicated investigations like an MRI PDFF, which is basically an MRI that assesses fat accumulation and liver grades of liver injury very accurately. But the problem is it's an expensive test and it's available only at selected centers. Liver biopsy. This is the gold standard for diagnosis of non-alcoholic steatohepatitis and fatty liver disease. But definitely this is where a part of tissue, part of, you might say, meat will be taken from your liver and analyzed. So it's an invasive procedure. It's not readily available everywhere. You need some expert people to do the procedure. You have to do some blood investigation before getting a liver biopsy done. You may have to get admitted to hospital for a day for observation. It can be painful and there might be complications. It's not as safe as an ultrasound abdomen procedure, and hence is not routinely ordered by majority of the doctors. This is another very important slide. If you have non-alcoholic fatty liver disease, that does not mean it's the end of your life. Majority of the people will have only isolated fatty liver with very mild inflammation. Majority of them will never progress to cirrhosis of liver. But again, about 1/4 to 1/5 of patients will progress to non-alcoholic steatohepatitis. Out of that, about 1/10 over a period of 15 years will go on to develop progressive liver fibrosis and cirrhosis. Once you have cirrhosis, then nearly half of the patient will decompensate in 7 to 10 years of time, and about 10%, 7 to 10% over a period of 6.5 to 7 years will go on to develop something like a hepatocellular carcinoma. So once you reach the stage of NASH cirrhosis or hepatocellular carcinoma or decompensation, that is at least NASH cirrhosis and beyond, that is when you will have different symptoms. And that is when majority of the cases are irreversible. Whatever you do, you are never going to get back your happy, smiling liver again. People with non-alcoholic fatty liver disease not only do die because of liver disease, but they do have increased chance of cardiovascular disease, that is simple heart attack. They have more chance of different cancers, which might be liver unrelated as well, and some other causes of death. Non-alcoholic fatty liver disease is a more serious form of non-alcoholic fatty liver disease, as I already mentioned. So this is not just simple fat that has accumulated within your liver. The fat is also causing damage to the liver in the form of inflammation. That inflammation with time will have a scarring within the liver. The scarring will progress to cirrhosis and permanent liver injury. How do you treat non-alcoholic steatohepatitis? The beauty of this disease is because it is primarily related to your lifestyle. The treatment is not medications, but to modify your lifestyle. So you have to have a healthy diet. You have to have a daily plan for exercise. You have to stop smoking. You have to stop alcohol. That is going to give you maximum benefit, not the medications. Having said that, There are medications for fatty liver disease, and there are newer medications which are coming up. There are multiple medications in the pipeline. How do you control your body weight? Many of the people do ask me, give me a medication. Yeah, sorry, am I visible and audible?
Yes, sir. Yes, we can continue.
Yeah.
Just make your slide in presentation.
Yeah, sure. Are the slides not visible? Yeah. So is the slide visible? Is the slide
Yes, sir.
visible?
Yes, sir.
Yes, sir. Yes, sir.
So basically, it has to be a combination of hypocaloric diet and exercise. And if you lose about 3 to 5% of your body weight, that helps improve the fat content of the liver. If you are able to achieve a weight loss up to 10%, then majority of the fibrosis within your liver, unless you are already cirrhotic, can be reversed. So the goal of weight loss should be 10% of what it is now. At least 7% will cause resolution of the inflammation which is present within the liver. If you lose even up to 5%, still that is great. If you lose even 3% of your body weight, that will decrease the fat content within your liver. So the diet basically has to have a balance of protein, fat, and carbohydrate. It should definitely be rich in vegetables. You are allowed to have fish, seafood, eggs, cheese, and yogurt, but decrease the content of red meat and sweets, especially the simple carbohydrates, which are not at all helpful to achieve the goal of weight loss. Aerobic exercises, they decrease fat in liver, it maintains healthy weight, it improves cardiovascular conditioning. If you do resistance exercises, that decreases liver inflammation, that is basically weight training, improves glucose absorption, and improves metabolic parameters with less energy consumption. The healthy tip from the NASH desk should be get enough of vitamins and minerals to food, get enough sleep, develop an exercise routine, eat small frequent meals, lower your sugar intake, and have at least a yearly health checkup if that is possible for you. Finally, coming to pharmacological approach, there are 3 drugs which are approved by the Indian National Society for the Study of Liver Disease. One is pioglitazone, which is basically an anti-diabetes drug, but can be used in non-diabetic if they have fatty liver disease. Saroglitazar, primarily maybe another anti-diabetic drug, can be used even in non-diabetic if you have fatty liver disease with or without inflammation. And vitamin E, something that is available even over the counter. If you use that in higher dose in non-diabetic patients, can be used for the treatment of fatty liver disease. How do you keep your liver healthy? Simply by limiting the intake of trans fat, by quitting smoking, by eating a balanced diet, by committing yourself to a regular exercise, by limiting or avoiding alcohol, by limiting consumption of refined carbohydrates, maintaining a healthy body weight, and by taking medications as prescribed, not over the counter or self-medication. So today, let us pledge to love our own liver and follow this NASH 24/7, the site which keeps you updated about the fatty liver disease. Thank you. If there is any question related to fatty liver disease, I'll be happy to take those questions.
Yeah, sure, sir, sure. Thank you so much for your wonderful talk, sir. We have some questions from the audience. So the question that we have is, I'm having grade 2 fatty liver in ultrasound. How I can avoid having NASH?
So first thing is to know that whether you actually at all already have NASH or not. Whether you have NASH or not, the first thing that you should concentrate is to have a healthy diet, like I already mentioned. The other one is to include a routine of exercise, be it aerobic or resistant training or a combination regularly. These 2 lifestyle modifications you can have today itself. Stop smoking, stop having alcohol if you are taking it, stop having refined carbohydrates, more of saturated fats, have a healthy diet. These are the basic things which are totally free of cost, which are totally under your control and can be started from today itself. This will help keeping your liver happy, healthy for a very long time, whether you have grade 1 or grade 2 or grade 3, whether you have NASH or not. These are the basic changes that you can bring, will definitely improve your liver condition.
Right, so that's a very detailed answer that you give. I hope the query must be resolved. Then another question that we have is fatty liver reversible?
Which fatty liver is reversible? So if you have simple fat accumulation within your liver, that is non-alcoholic fatty liver disease without steatohepatitis, that's definitely reversible. If you have steatohepatitis, that is only inflammation within your liver, that is also reversible, very much reversible. If you have a mild degree of fibrosis or scarring within your liver, that is also reversible if you have adequate weight loss. But you have advanced fibrosis or cirrhosis of liver, that is not reversible.
Right. So I think the early diagnosis of fatty liver, that will definitely help the patients to get their fatty
Surely,
liver.
definitely.
Yeah. Thank you so much, sir. Thank you for your time. And on the behalf of NASH 24/7, I thank you for this lively and informative talk. So, as you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctor and continue their medications. With careful observation and precaution, it is possible to obtain control on the disease. That we get to know from your talk. I would also like to thank our audience for their active participation and patience in making this event successful. Stay connected with NASH 24/7 on Facebook and take care of yourself and your family members. Thank you. Thank you, sir. Thank you so much.
Thank you. Thank you.